Zika virus has made news around the world and has recently made an appearance in the United States. Are Pennsylvanians at risk for contracting Zika? Pennsylvania Medical Society brought together physician experts and the Pennsylvania Department of Health to discuss Zika with the news media on January 29th. Though there have been no Zika virus infections identified among Pennsylvania residents as of January 29th, Dr. Lauren Robinson from the Pennsylvania Department of Health said the DOH is closely following the surveillance and advisory information coming out of the Centers for Disease Control and Prevention.
We're really asking folks to pay attention to the travel advisories issued with regard to the 22 affected countries and regions, specifically with regard to pregnant women, and ask that pregnant women consult with their healthcare providers if they have traveled to the regions recently and if there's travel planned.
Dr. Robinson confirmed that the state will look to monitor mosquito activity as the weather warms up. Dr. Stephen Kolodny and Dr. Ray Ponser, infectious disease specialists in Pennsylvania, talked about the virus and how it spreads.
The symptoms are similar to those of dengue fever and chikungunya, which include fever, rash, body aches, joint aches, and conjunctivitis. And as noted, many of these patients won't have any symptoms whatsoever. The incubation period is relatively short, and the recovery period is usually within a week to 10 days.
Because there's an increased risk for pregnant women, Dr. Kurt Barnhart, chair of the Pennsylvania section of the American Congress of Obstetricians and Gynecologists, talked about what is known and unknown about the chance of transmitting the virus from mother to infant.
We do not know what the rate of vertical transmission is. We don't know if this is a common occurrence or a very rare occurrence, but it's certainly not occurring in every woman that's pregnant that has Zika virus. It's only occurring in a subset. We also don't know whether this vertical transmission is more common or more possible if a woman is symptomatic in her with Zika virus or whether she's asymptomatic. And as we heard, it's more common to be asymptomatic with the virus. We also don't know whether the transmission to the fetus confers a different risk based on what trimester the exposure is in. Although historically, most pregnancy-related problems with the fetus, exposure in the first trimester is the most dangerous and the most likely to result in problems of a developing fetus.
Medical Society's role is primarily educational. Our job, as always, is we keep our members up to date through all of our communication channels, but we also work with our media partners to help keep the public informed. We're in regular touch with the Pennsylvania Department of Health and the Centers for Disease Control and Prevention, and we'll continue to do so as part of our team here to keep Pennsylvania healthy and safe.